Good day to everyone. Now, the topic is all about adult common diseases. So we finished already the childhood common diseases. So now let's take a look what are those diseases which are common to adult patients. So let's start with endocrine system. So the number one example of our endocrine disorders is the diabetes mellitus. Diabetes mellitus is very prominent because almost most of adults, okay, when they reach adulthood, they will have diabetes, okay. So diabetes mellitus is chronic disorder of impaired carbohydrate, protein, lipid metabolism caused by a deficiency of insulin. Insulin is a hormones, which is secreted by your pancreas. Okay, as we've discussed in our body systems, this is important. Insulin is important to regulate your blood sugar level. Without insulin, your sugar will get higher. Then, and it's an absolute or relative deficiency of insulin, results in hyperglycemia. So hyperglycemia means increased blood glucose level in the blood. So we have two types of diabetes. We have the type 1 and type 2. Very easy. Type 1 and type 2. What's the difference between the two? Type 1, insulin is not produced. Okay? Wala talagang insulin na napuproduce ang katawan mo or yung pancreas mo. That is type 1. Usually, type 1 diabetes, it is from nagsisimula siya ng bata ka pa. Like si Gary V, ang tawag sa kanya is type 1 diabetes because ang diabetes ay simula ng pagkabata. Then, type 2 diabetes, okay? Type 2 diabetes, meron siyang insulin pero insufficient siya para i-regulate yung mga sugar natin sa katawan. So, usually, ang diabetes mellitus type 2 ay nangyayari pag nasa age of 50s na tayo. It's because of your diet, it's because of your lifestyle. So, ito ang difference between the two diabetes. Okay? Type 1 generally appears before the age of 40. So sabi ko nga, before pa lang, bata ka pa lang, pwede ka na magkaroon ng type 1. While type 2 is generally appears after the age of 40s. Develops if your body can't produce insulin. Wala talagang insulin na puproduce sa katawan mo. That's type 1. While type 2, there is insulin but it's insufficient to, or it's not enough for your body, okay, to regulate the blood sugar in your body. So diabetes type 1, actually, it's unknown. Bakit ka nagkakaroon ng diabetes type 1? But type 2, it's familial history, low activity level, like your lifestyle is hindi maganda, poor diet, and excess body weight. So ayan yung mga causes kung bakit ka nagkakaroon ng diabetes. So signs and symptoms of having diabetes is, we always remember the 3 P's of diabetes, this one. Okay, 3 P's of diabetes. First P is polyuria. So it will be increased urination, ihi siya ng ihi. Polydipsia means increased thirst. And polyphagia, it's increased hunger. So that's the signs and symptoms of diabetes. Polydipsia, polyphagia, and polyuria. We have also cosmos breathing, sa respiratory. We have blurred vision, smell of acetone, abdominal pain, nausea and vomiting, glycosuria, polyuria, peripheral neuropathy, and infections or yeast infections. So, anong mga complication? Tandaan natin, ang diabetes is isa siyang taksil na sakit kasi marami siyang tinatamaang system. So, pag sa brain siya tumama, sa brain ay naapektuhan na ang brain mo because of severe sugar, pwede ka magkaroon ng stroke kasi babara sa utak yung magiging masyado ng malapot yung blood supply mo sa brain, so hindi niya na kayang i-supply yung mga oxygen, so pwede kang ma-stroke. Then, heart disease and hypertension, renal disease sa kidney, peripheral vascular disease, so pwedeng kaya nangingitim yung mga paa mo at kamay mo because of peripheral vascular disease. Neuropathy, namamanhid, foot problems, like gangrene. So these are the complications. So anong management natin sa So let's take a look what is diabetic ketoacidosis and hyperglycemic hyperosmolar non-ketotic syndrome. So, what's the difference between the two? DKA or diabetic ketoacidosis, okay, yan yung complication ng type 1 diabetes. Yan yung pinakamalalang form. So, it occurs with a severe insulin deficiency. Ang manifestation niyan ay nadidehydrate na si patient, hyperglycemia, ketosis, and acidosis. Kaya nagkakaroon ng acetone breath si patient dahil yung fats natin, minametabolize siya after ng sugar. So, pati fats natin minametabolize, kaya ang amoy nun is acidotic, acidosis and ketosis. Kaya tayo nagkakaroon ng amoy na acetone breath. So, ang treatment doon, restore blood volume, treat dehydration, treat hyperglycemia, correct electrolyte imbalance, and monitor potassium levels. Sa HHNS naman, ito naman yung extreme form ng diabetes type 2. So, ketosis and acidosis do not occur. CNS alterations, dehydration, or electrolyte loss. So, ang treatment niya, parehas lang sa DKA, fluid replacement, administer insulin, and rehydration alone. So, ang management natin sa patient na may diabetes, number 1 is insulin. Okay? So, we have different types of insulin. We have the rapid, the short-acting, the intermediate, and the long-acting. When we're talking about rapid-acting, kaya sa rapid, napakabilis ng onset niya or ng effect niya. Okay? So, pag binigay mo siya, example niya is Humalog, Novolog, and Apidra. Pag binigay mo siya, 10 to 30 minutes, nasa bloodstream mo na siya. Then, 30 minutes to 3 hours, most effective siya or peak na siya. And 3 to 5 hours, ganun siya katagal nag-i-stay sa katawan. So, make sure nyo, pag ang patient nyo is naka-rapid acting at naka-short acting, dahil mabilis ang effect niya, make sure nyo, before nyo bigay ito, make sure na yung pagkain is ready na. Kasi, ang instruction nyo, pag ang patient nyo is naka-rapid acting at naka-short acting, dapat ang food is available na sa bedside. Kasi may possibility kung hindi pa pala ready ang food at na-inject mo na siya ng masyadong maaga, yung insulin, pwedeng magkaroon ng hypoglycemia ang patient or masyadong bumaba ang sugar niya. So, ang short-acting natin, example niya is regular insulin. 10 to 30 minutes is mag-e-effect na siya. And then, ang peak hours niya is 2 to 5 hours. Then, up to 2 to 12 hours siyang mag-stay sa katawan. Intermediate naman, NPG ang example niya. Onset niya is 1.5 hours to 4 hours. Then, ang peak niya is 4 to 12 hours. And then, duration niya is up to 24 hours. Ang long-acting, example niyan is Lantus and Levemir. Ang onset niya is 0.8 to 4 hours. So, matagal siya mag-effect. Minimal peak and hanggang whole day siyang ang duration niya sa katawan. So, ang very important lang dito is rapid acting and short acting. Make sure na yung food ay available na sa bedside before kayo magbigay ng insulin. And always remember na ang insulin bago ibigay, you should check first the blood sugar or the CBG or POCP of your patient. So we have different side effects of insulin. Number one is hypoglycemia. If you fail, or if you fail to check the sugar of the patient and you don't know that the sugar is low, and then suddenly you give insulin, so ano mangyayari? Babagsak lalo ang insulin. So pwede siya magkaroon ng hypoglycemia. So anong makikita mo sa patient na hypoglycemia? Nanginginig, fast heartbeat, nagpapawis, nahihilo, anxious, nagugutom, impaired vision, weakness and fatigue, headache, and irritable. So, anong pwede mong gawin sa kanya? What you can do is, pag nag-hypoglycemia ang patient mo, pag sinabi natin cold and clammy, needs some candy. So, ang pwede mong treatment sa hypoglycemia patient is you give a hard candy or any simple sugar can do, like glass of juice, regular soft drinks, 1 glass of milk, eat some soft candies, not chocolate. Bakit not chocolate? Kasi ang chocolate is sucrose siya. Hindi siya simple sugar, so matagal pa siyang ma-absorb ng katawan. Dapat simple sugar lang. So pag nabigyan nyo na siya ng sugar, so parang nagdahilan lang si patient, parang wala lang nangyari sa kanya. So this is side effect of insulin. One is hypoglycemia. Next is hypokalemia. Hypokalemia, hypo means low, kalemia is potassium. So, pwedeng magkaroon ng hypokalemia ang patient kasi nga ang insulin causes shift of potassium from extracellular to intracellular. So, yan yung nangyayari. Extracellular sa labas ng cell, intra is sa loob ng cell. Hypersensitivity reactions, pwede siyang magkaroon ng allergic reaction. Insulin resistance, pag masyado ng mataas ang sugar niya, minsan nagkakaroon ng resistance. So, kailangan dagdagan ang insulin as prescribed by the doctor. Local side effects, lipodystrophy, ano nangyayari doon? Yung mga nangingitim-ngitim, nagpapasa-pasa. So, anong pwede mong gawin para ma-prevent yung lipodystrophy? Dapat iikot mo yung insulin or injection. So, kung nandito ka sa right, next na injection mo, sa left naman na tiyan. Then, local infection. So, anong management mo sa diabetic patient? First is nutritional modification. Okay? Dapat talaga magbabago ang pagkain ng patient. Lalo na kung mataas ang sugar niya, dapat controlled ang sugar level. Dapat may 2 snacks. Okay? Makikita nyo, diabetic patient sa hospital, binibigyan sila ng 2 snacks and 3 meals. Kasi, para ma-prevent yung hypoglycemia. Regular exercise, regular glucose monitoring, drug therapy, and then, very important ang client education. Kung hindi ka nakapag-client education, okay, bukas makalawa, nandyan ulit ang patient mo because of the same problem. So next is gastrointestinal disease. So gastrointestinal disease first is yung gastritis. Gastritis means, gastric means the stomach, and itis means inflammation. So there is inflammation of the stomach or gastric mucosa. So anong causes ng mga gastritis natin? First is yung alcohol, then yung coffee, then fast food, and then cigarette. So these are the 4 usual causes of gastritis. So we have the acute gastritis and we have the chronic gastritis. Pag sinabi mong acute, biglaan lang siya. Pag sinabi mong chronic, pangmatagalan. Okay, usually 6 months and longer. So ayan ang signs and symptoms ng gastritis. Nasusuka ka, feeling mo biniburn yung tiyan mo, upset stomach, loss of appetite, blood vomiting. Bakit? Kasi nagasgas na yung tiyan mo, kaya ka nagva-vomit na ng blood or black stool. Anong management natin? First is reducing anxiety, then promoting optimal nutrition. So anong nutrition? Anong food ang binibigay natin sa mga gastric patient? It should be bland diet. Hindi tayo pwede magbigay ng may makukulay na pagkain, maanghang, may mga spices. Bakit? Kasi lalong aggravate ng symptoms yung mga ganung food. So, dapat blunt lang siya, like yung sabaw, clear na sabaw, or yung lugaw. So, yun yung mga bland diet. Matabang lang din siya. Then, promoting fluid balance and then relieving pain. So, pag lumala na si gastritis, pwede na siyang maging peptic ulcer disease. So, peptic ulcer disease are defects in the gastric or duodenal mucosa that extend through the muscular mucosa. So, lumalim na siya hanggang sa muscles, nagkaroon na siya ng uka or ng ulcer. So, ito yung mas masakit, ito yung pwedeng mas grabe ang complication. So we have two types of ulcer. We have the gastric, nasa tiyan siya, and we have the duodenal. So we have the duodenal, dito na siya sa papunta or part na ng small intestine. So sa gastric ulcer, pain after food intake, while duodenal ulcer, may pain siya before food intake. Less common, more common ang duodenal. Hematemesis is vomiting of blood. Hema means blood and emesis means vomiting. So it's vomiting of blood. Nagkakaroon ka ng vomiting of blood. Bakit? Kasi nga, mas malapit ang stomach kaysa sa small intestine. So pwedeng mag-vomit ka. Melena is more common. Pag sinabi mo namang melena is black stool. So mas malayo siya sa mouth. So ang gagawin mo is tatay ka na lang ng black stool. Bakit siya naging black? Kasi dumaan siya sa, marami pa siyang dinaanan, kaya instead na bright siya, naging black mo na siya. Weight loss, weight gain sa isa, and then equal in both sexes, common in males. Anong causes ng peptic ulcer? First is yung H. pylori bacteria. So according to study, ang nagkakos daw ng peptic ulcer ay isang bacteria na tinatawag nating Helicobacter pylori or H. pylori. So non-steroidal anti-inflammatory drugs, kung mahilig kayo sa ibuprofen or Celebrex or any NSAIDs, okay, malakas ang risk nyo na magkaroon kayo ng mefenamic acid. Malakas na magkaroon kayo ng chance na magkaroon kayo ng peptic ulcer kasi nakakagasgas yan ng stomach. Masyado kayong stress, okay? Tandaan nyo, pag stress kayo, nagkikreate ng more acid ang inyong tiyan. Smoking, nagkikreate din yan ng acid environment sa inyong tiyan. Alcohol consumption, same. And then genetics, namamana din siya. So, anong signs and symptoms ng peptic ulcer? Almost same sa gastritis. Okay? Pain in the stomach, sobrang sakit po niyan. Indigestion, hindi ka matunawan. Loss of appetite, nausea, bloating, heartburn, blood in the vomitus, and then stool discoloration, which is color black. Anong management natin? Monitor vital signs and for signs of bleeding. Okay, bakit? Kasi nga may ulcer siya. So, pwede siyang mag-bleed. Administer small, frequent, bland feeding. So, as I've told you, dapat ang diet niya is bland. Avoid consuming alcohol and substances that contain caffeine or chocolate. Ang caffeine or coffee or chocolate or any milk products, okay, nagkukos yan or nag-i-increase yan ng acid sa stomach. Kaya dapat i-prevent din sila. Avoid smoking, avoid aspirin or NSAIDs, and obtain adequate rest and reduce stress. Okay? Cirrhosis. So next is cirrhosis. Cirrhosis is the problem which causes your liver or yung atay mo na maging fibrotic. So ano yung fibrotic na sinasabi? Kung ito ang normal na liver mo, pag nagkaroon ka na ng cirrhosis or cirrhotic na ang liver mo, nagkakaroon na siya ng fibrosis or nagiging ganito, matigas na siya. Bakit? Because of this causes. Number one cause is yung alcohol. Okay? Or hepatitis. Kung nagkaroon ka ng hepatitis, pwede ka rin magkaroon ng cirrhosis. Prolonged cholestasis. Okay? Yung bile mo nagkaroon ng problema. Occlusion of the hepatic veins. And then, there is also unknown causes. So, anong signs and symptoms ng cirrhosis? So, first is yung jaundice. Pag sinabi mong jaundice, okay, jaundice is yung yellowish discoloration of the skin. Okay, kulay yellow siya. Nakita nyo may mga problema sa atay, nagiging kulay yellow. Ang tawag doon ay jaundice. Okay? Esophageal varices. Esophageal varices, ito siya. Okay, meron kayo dyan na lumalaki, namamaga. Ascites, as I told you, is lumalaki yung tiyan. Kasi nga namamaga ang atay, kaya lumalaki ang tiyan. Then hepatomegaly is enlargement. Megaly means enlargement, hepato means liver. So there's an enlargement of the liver. Then splenomegaly is namamaga naman ang spleen. Pwedeng magkaroon ka din ng hemorrhoids at edema, swelling, changes in mental responsiveness in memory, spider angioma, anemia, palmar erythema. Then, pwede ka rin magkaroon ng sexual changes. Like, lumalaki yung gynecomastia, lumalaki yung boobs mo, and hirsutism, masyadong dumadami yung buhok mo sa katawan. Peripheral neuropathy is namamanhid ang periphery mo o yung mga legs and kamay mo. So, ito yung mga signs and symptoms ng cirrhosis. So, complication niya, pwede magkaroon ng portal hypertension, ascites, hepatic encephalopathy, and bleeding disorders. Bakit ka pwede? Pwede ka rin magkaroon ng hepatocellular carcinoma o pwede itong mauwi sa cancer. So, ano ba nangyayari sa patient na may cirrhosis? Okay? If you remember, anong function ng liver nyo, okay? Lahat ng function ng liver nyo, maraming function ng liver. So, lahat ng function ng liver nyo is ma-alter. It's because hindi siya gumagana dahil nga meron siyang sakit, which is cirrhosis. So, lahat ng mga function niya sa katawan ay hindi niya nagagawa. Which is, number 1 is yung detoxification. So, anong mga dinedetoxify niya? Lahat ng pwedeng i-detoxify. So, lahat ng mga toxins sa katawan ay hindi mo na ilalabas. That's why, ang katawan mo ay pwedeng mag-accumulate ng toxins kasi nga si liver ay hindi niya na-detoxify. So, ang isa doon ay ang tinatawag nating ang end product ng kinakain mo na protein, which is yung creatinine and urea. Creatinine and urea, especially urea. So, yan yung end product ng protein na kinakain mo, like baboy, fish. So, yan yung mga toxic, yan yung mga end product na dapat nilalabas mo through sa pagtae, sa pag-ihi. But wala kang, pero dahil wala kang liver, hindi yun madidetoxify. So, magre-retain lang yun sa blood mo. So, ano mangyayari sa'yo? Magiging intoxicated ka, magiging yung toxins is mapupunta sa pwedeng sa blood, pwedeng sa brain. Kaya ka nagkakaroon ng mental changes sa mental responsiveness. And pwede, ang pinakamalala ay pwede ka magkaroon ng hepatic encephalopathy or hepatic coma. So nagiging nakokoma ka na lang dahil yung toxins ay kinakain na ang buong katawan mo. So yan yung malalang magiging side complication ng cirrhosis. So ano ang management natin para sa cirrhosis? First is yung napaka-importanteng adequate nutrition. Dapat 2,000 to 3,000 calorie per day. High protein to help liver regenerate unless encephalopathy is there. So kung ang patient is wala pa siyang hepatic encephalopathy or wala pa siyang hepatic coma, okay, pwede mo pa siyang pakainin ng high protein. Pero kung meron na siyang hepatic encephalopathy, dapat low to moderate protein na lang. Bakit? Tulad ng sinabi ko, ang protein, ang end product niyan ay tinatawag nating urea and creatinine. So pag mas dinadamihan mo ang protein, mas dinadamihan mo din ang end product niya, which is toxic sa katawan. Kaya nililimit lang ang protein pag meron na siyang encephalopathy. Then high CHO. CHO is fat. Fat restriction is not necessary. Then, restrict fluid and electrolyte intake. Restrict yung fluid lalo na. Kasi nga meron na siyang edema at saka ascites, swelling. So, dapat less lang ang fluid or restricted lang. Rest frequently, control temperature, anti-emetic like yung sa suka to control yung suka, antacids, anti-diarrheal as ordered. Vitamin supplements like fat-soluble. Then, remove all hepatotoxic drugs like yung mga antibiotics, like yung mga mefenamic. Avoid alcohol and give antibiotic if ordered. So that are the managements for cirrhosis. So next is hepatitis. Hepatitis is inflammation of the liver. Okay, it is a condition, can be self-limiting or can progress to fibrosis, cirrhosis, or liver cancer. So, this is your healthy liver. Pag nag-inflame siya, ganyan. Okay? We have different types of hepatitis. Let's remember A, B, C, D. Okay? Hepatitis A, hepatitis B, hepatitis C, hepatitis D, and E. Okay? So, yung tatlong nasa gitna, B, C, and D, nakukuha mo yan sa blood and body products. First, kung nakipag-sex ka sa taong may hepatitis. Next, kung natusok ka ng needle na may hepatitis. Next, kung nasalinian ka ng dugo na may hepatitis. That's how you will get the type B, type C, and type D hepatitis. Pag type A and type E naman, okay, pwedeng yung food mo na nagkaroon ng dumi ng tao ng infected ng hepatitis A and hepatitis E. Okay, so that's how you contracted this disease. Anong signs and symptoms ng may hepatitis? First is fatigue, nausea, mild fever, yellow skin or jaundice, stomach pain, and dark urine. Okay? Anong management natin? Pag hepatitis A and E ka, dapat ang precaution sa'yo, contact. So, hindi mo siya pwedeng hawakan, dapat mag-gloves ka. Okay? Kasi pag nahawakan mo siya, pwede kang magkaroon ng hepatitis A and E. Okay? While hepatitis B, C, and D, it is universal or standard precautions. So, dapat naka-PPE ka sa universal and standard precautions. Limit activity, bed rest, initially to promote hepatic healing. Patient education, dietary education, it should be high carbohydrate, high calorie, low to moderate fat, and low moderate protein. Bakit low moderate protein? Tulad ng sabi ko, pag hindi na nagpo-function ang liver mo, so pwedeng hindi niya na nasasala ang mga toxic, which is one is yung protein end product, which is creatinine and urea. So dapat low lang siya, yung ibibigay mo na protein. Cardiac disease. So first one is coronary artery disease. So this is our normal artery, okay? And this is the narrowed artery. Pag sinabi mong coronary artery disease, okay, nagkakaroon ng lipid deposit of plaque sa gilid hanggang lumiit na yung daanan ng blood. Okay? So pag lumiit na yung daanan ng blood, pwede ka magkaroon ng hypertension or any other diseases like stroke, heart attack. So yun na yung mag-i-start. So imagine, this is your normal artery sa puso. Ito yung coronary artery disease. So imagine niyo hindi na makakalusot yung blood dito. So pwede yan, mamatay yung puso. So anong causes nito? First is yung smoking. Bakit? Because ang cigarette, nagko-contain niya ng nicotine, which is a potent vasoconstrictor. Pag sinabi mong potent vasoconstrictor, nililiit niya yung daanan ng blood. Hypertension, mataas ang BP. Hypercholesterolemia. Bakit? Kasi nag-i-stack dito yung cholesterol na nakakabara pa sa puso. Diabetes, yung mga sugar, excess sugar, nag-i-stack din dyan. And sedentary lifestyle, hindi ka kumikilos, hindi ka nag-exercise. Nakakadagdag din siya. So, anong signs and symptoms na meron kang coronary artery disease? Dizziness, anxiety, nausea, chest pain, heartburn, irregular heart rate, weakness, burning sensation. So, paano natin to gagamutin? Promoting oxygen and tissue perfusion. So, first is, instruct the patient to avoid over-fatigue. Oxygen therapy by cannula for the first 24 to 48 hours. Position the patient into semi-foulers kasi nga hirap siya huminga. So, i-position mo siya nang mas makakahinga siya. Promoting adequate oxygen. Promoting comfort. Okay? So, mas i-emphasize ko yan later on. So, next is angina. Pag sinabi mong angina or angina pectoris, it is a severe chest pain. Severe chest pain because there is inadequate supply of oxygen required by the heart because of the plaque or because of the blockage, hindi na siya nasusuplayan ng maayos. We have different types of angina. We have the unstable. Okay? Yung stable is mag-rest ka lang, mawawala na siya. Pag unstable, kahit mag-rest ka, masakit pa din siya. And yun yung nagli-lead sa heart attack. Intractable, severe, silent ischemia, it's for diabetics, Prince-Metal, vasospasm. So risk factors for angina, we have the high blood pressure, we have the diabetes mellitus, unhealthy cholesterol levels, smoking, lack of exercise, and obesity. So anong signs and symptoms na meron kang angina? Ito yung mga part ng katawan na sumasakit maliban sa chest or sa puso. So pwedeng sa back mo or dito sa mga kamay mo na to, okay? Or sa neck, back, ito yung puso, or pwedeng sa jaw din siya. Okay? So, yun yung mga site na nagkakaroon ka ng pain maliban sa chest. Shortness of breath, feeling tired or fatigue, feeling lightheaded, nausea, sweating, and weakness. Usually, ang sumasakit sa part ng kamay mo is yung sa left kasi doon part mas malapit ang puso. So, ano management natin? First is promoting comfort. Okay? Dapat bigyan siya ng oxygen. Because kaya siya nagkakaroon ng chest pain, there is oxygen-hungry heart. Promoting tissue perfusion, promoting activity and rest, promoting relief of anxiety, and patient and family education. So, kailangan nila ang rest. So, usually, ang mga patient na ganito, as in, hindi sila pinaglalakad, pinibigyan sila ng arenola malapit sa kanilang sa urinal or ng bedpan sa bed nila kasi hindi sila pwedeng paglakarin. Kasi pag naglakad sila, pwede ulit silang mag-chest pain. So, dapat adequate rest. Then, next, ang pag lumala na siya, ang tawag na sa kanya is myocardial infarction. Myocardial infarction is also called as heart attack. Okay? It is defined as a disease condition which is caused by a reduced blood flow in a coronary artery. Okay? So, hindi na nakayanan ng insufficient yung oxygen supply sa puso mo. Okay? So, ano nangyayari? Namamatay yung part ng puso mo na hindi nasusuplayan. Kaya ina-atake sa puso. So, that is myocardial infarction. Anong causes niyan? Same sa causes ng chest pain at saka ng coronary artery disease like diabetes, mellitus, hypertension, LDL, yan yung mga types, and HDL, yan yung mga types ng cholesterol, triglycerides, cholesterol din yan, and obesity. Okay? Lack of exercise, stress, and dietary saturated fats, and smoking. So, yan yung mga causes ng MI. So, anong signs and symptoms? Parang ganito nangyayari sa patient na may MI. Feeling mo, there is a crushing pain. there is a tightness, there is pain in your jaw, shoulder, arm, neck, back, and substernal. Pain may be radiating. Radiating, ibig sabihin is lumalakad. So, dyspnea, meron ka na hihirapan ka ding huminga, syncope, decrease yung BP mo, nausea, vomiting, extreme weakness, diaphoresis, ibig sabihin excessive sweating, denial is common, and increased heart rate. So, anong treatment mo pag meron kang MI or heart attack? So, just always remember si Mona Lisa. Okay? Si Mona Lisa. So, ibig sabihin nun is si Mona. So, M for morphine, O for oxygen, N for nitroglycerin, A for aspirin. So usually itong treatment na to pag nagkaroon ka na ng recurrent heart attack. Kasi pag first heart attack mo, hindi mo pa makukuha tong mga gamot na to. Pero pag inatake ka ulit, kung alam mo na ang MONA, so alam mo na ang iti-treat mo sa patient mo kasi available na yung mga gamot. So M is morphine. Morphine is for chest pain or for pain. O is for oxygen kasi nga kulang ang oxygen ang heart mo, so kailangan mo siyang bigyan ng oxygen for support. And for nitroglycerin, nitroglycerin is it is a vasodilator. Ibig sabihin, kung ganito lang kaliit yung daanan ng blood mo, okay, so pinapalaki ng nitroglycerin yan. So, yun yung effect ng nitroglycerin. And aspirin, yun yung tinutunaw yung mga bara-bara sa puso. So, that is MONA. So, pacemaker naman, it is an electronic device used to pace the heart when the normal conduction pathway is damaged or diseased. So, ang pacemaker, we all know that our heart is run by an electricity. Okay, may electricity yan, kaya yan nagpa-pump. But there are some condition na dinadamage yung electricity na yon, pinuputol yung electricity na yon. So, ano mangyayari? Hindi siya titibok. So, we are putting a device para as a substitute dun sa electricity na nawala. So, ang tawag doon ay pacemaker. So, pag may pacemaker ang patient, ito, usong-uso to sa mga matatanda sa US or sa ibang bansa, Canada, meron sila nito kasi they can afford and it's also included in their insurances. So, dapat alam natin ang gagawin pag may pacemaker ang mga patient natin. So, first is instruct the client in signs of battery failure. Okay? So, itong pacemaker, meron tong battery, usually 2 years ang tinatagal niya. Then, papalitan siya after 2 years. So, dapat alam niya yung mga signs and symptoms or signs na ang battery ay humihina na. Instruct the client to report any fever, redness, swelling, or drainage from the insertion site. Bakit? Kasi it means na inoperahan pala yun para lagay yung pacemaker. So, pag merong redness, swelling, so pwedeng nag-infect siya. Then, report signs of dizziness, weakness, or fatigue. Keep a pacemaker. Dapat lahat ng may pacemaker, dapat lahat sila merong ID band na sinasabi na meron silang pacemaker. Take the pulse daily and to maintain dietary pulses, wear loose-fitting clothing. Okay, dapat loose yung clothes nila. Then, avoid contact sports. Inform all healthcare providers that the pacemaker has been inserted. So, pag nagpapa-x-ray ka, nagpapa-CT scan ka, nasa airport ka, inform nyo yung mga tao doon. Bakit? Kasi sometimes mag-a-alarm yan. Kaya pala nag-a-alarm dahil may pacemaker yung patient nyo. Instruct the client that most electrical appliances can be used without any interfere with the functioning of the pacemaker. Avoid transmitter towers and anti-theft device in stores. Instruct the client that is any unusual feelings occur when near any devices to move 5 to 10 feet. Okay, and check the pulse. Kasi sometimes yung mga devices or mga electrical devices pwedeng mag-affect yan sa sa pacemaker mo kasi pareha silang electric. Then emphasize the importance of follow-up. Next is sensory disorders. So sensory disorders includes any disorders which is in your eyes, in your nose, in your ears. So refractive or errors. So refractive errors, we have different types. We have the myopia or the nearsightedness. We have the hypermetropia or farsightedness, and astigmatism, blurred vision. We have also presbyopia. Usually presbyopia is seen to patients who is old. So the lens ages and stiffens, bringing the focal point behind the retina and causing blurry vision. Anong causes nun? Visual stress, age, and heredity. So anong signs and symptoms ng refractive errors? You have the double and blurred vision, haziness, eye squinting, headaches, glared around bright lights, eye strain, dry out eyes, itching, redness, and irritation. So anong management mo? Glasses. So legal blindness, if even with some type of correction, the person has 20 to 200 acuity. So ito yung normal natin. Or less, they are considered legally blind. 20 over 200 means that the person sees 20 feet when a person without vision problems sees 200 feet. If you are legally blind, the person has a field of vision so narrow that its wildest diameter subtends an angular distance no greater than 20 degrees. Okay? So, ayun ang ibig sabihin ng legal blindness. So, causes nito is macular degeneration, glaucoma, diabetic retinopathy, cataract, optic nerve atrophy, and all other is unknown. Okay? Anong signs and symptoms nito? Flashing lights, floaters, sudden loss of vision, eye pain, eye injury, persistent discomfort in the eye, red eye discomfort, and blurred vision. When speaking to a client who has limited sight or is blind, the caregiver should use a normal tone or voice para hindi sila magulat. Alert the client when approaching. Paano mo siya i-alert? Pwede mo siyang hawakan dito sa shoulder. Then orient the client to the environment. Use a focal point and provide further orientation of the environment. Allow the client to touch objects in the room so you will be familiarized kung anong meron sa room. Use the clock placement of foods on the meal tray to orient the client. Then promote independence as much as possible. So that's all for adult diseases. Thank you.